Fibrodysplasia ossificans progressiva by Melody Longoria, Erica Gonzalez, Karen Garcia, Maria Castrejon, Haley Morales, and Vianney Catalan.
What is fibrodysplasia ossificans progressiva, or FOP? Stoneman syndrome is also called fibrodysplasia, or Stoneman syndrome. The likelihood of someone getting fibrodysplasia is only 1 out of 2 million people and was discovered in 2006. Fibrodysplasia is a disease that causes muscle, tissues, and ligaments to be turned into stone. The symptoms of fibrodysplasia is a short, bent, and sometimes inward toe. The missing joint that is inside of the toe is what causes the toe to be unable to bend and move. Another symptom of fibrodysplasia is a red, painful swelling that clears up and leaves behind a piece of mature bone.
I present this graph as a result of genetic testing done for a case study on a few young children with deformed big toes at birth, so before heterotopic ossification. The top graph is the control, and the bottom graph is the results of said patients, both panels showing forward and backward sequencing results. And all of the patients had a single mutated nucleotide substitution resulting in their disease. Which nucleotide specifically? It was a nucleotide R with bases A and G in position C617 in forward sequencing, and Y with bases C and T in the reverse sequencing. There have also been several cases without any history of the genetic disorder in the family. Surgical removal of extra bone growth, a fall or injury, and even a viral illness are all dangerous because the body's repair mechanisms can repair the affected area with the formation of extra unnecessary bone. They set off episodes of swelling, resulting in permanent bone growth. Hello, I'm Erica Gonzalez, and I'll be presenting our etiology. So what exactly is etiology? It's pretty much just where a disease originates from. So in this case, FOP is a genetic condition passed on from generation to generation, even when just one parent has a dormant abnormal gene. Most cases of FOP are caused by a mutation in the activin receptor type 1 gene, along with bone morphogenetic proteins. The ACVR1 gene is responsible for controlling the growth and development of bones and muscles in the human body.
Hi, my name is Haley Morales. Our project is over fibrodysplasia, which can also be known as Stoneman syndrome. Stoneman syndrome is basically the disease where the ossification of connective tissues leads to progressive fusion by the axial and appendicular skeleton. My part specifically to cover was pathogenesis. Basically, pathogenesis is the manner of development of a disease, the origination of it, and how it begins or develops over a span of time. This disease is often started or recognized as flare-ups, which can be mistaken for another disease or disorder when brought up to a medical professional. It often is described as lumps of bone in the body, which appear from extraneous activity or injuries. This disease can develop as long as a span of 10 years and can severely affect a person's quality of life. It can cause severe immobility, making simple everyday tasks difficult to complete by themselves or just at all. Most can live with this disease for about 40 years, but the most common cause of death can be from cardiac arrest or respiratory failure due to swelling and restriction of the chest wall movements.
Cure for this disease, there are several treatments that can help patients reduce pain. One of the treatments that is recommended for patients that suffer from muscle spasms is muscle relaxants. Furthermore, occupational therapy is recommended for the patient's mobility. While surgery would seem like a good treatment to remove the excess bone, the bone does not only regrow, but it becomes more painful for the patient.
Hello, my name is Karen, and I'll be doing the same part of the treatments. For people who cannot afford treatments or wish to find alternative options, holistic medicine is one of the most popular methods since there's no cure for the disease. One of the options is acupuncture, which is said to relieve pain in the body by opening energy gates that are being blocked by the growing bones. Another method is cupping. By heating up cups of glass, suction is created and placed upon the skin to provide blood flow on the surface of the skin. This is said to provide blood flow for patients whose infected area has been overrun with bone growth, relieving the stress in the area.
My name is Vianney Catalan, and I will be discussing the prognosis of Stoneman syndrome. When we look into the prognosis, we can see how the average lifespan of someone who is diagnosed is 40 years old. This is mainly caused by the complications that arise after having the disease for 2 decades. This can also cause you to become wheelchaired and face death. This can happen because of thoracic insufficiency syndrome, which is a deformity in your thoracic cavity of your body. This affects your major organs such as your heart and your lungs and can cause a lack of respiration and a lack of lung growth.
For most patients, the common method of diagnosing by doctors is the presence of a deformed toe on their feet. As they get older, movement tends to slow down due to bone replacing muscle and joint tissue, thus decreasing mobility. As their life overall quality of life is drastically reduced due to chronic pain and limited mobility, making them depending on other people.
Throughout the years, there's been more research about this disease. So far, a biotechnology company named Regeneron developed an antibody that blocks activin A, that activates ACVR1. The antibody has not yet been tried on human subjects.
Now looking into current research of the disease, a case in 2019 studied by Biomed Central Institution examined a Pakistani boy that was diagnosed with Stoneman syndrome. This proved how severe and sensitive the disease was. X-rays showed how his body had worsened over time. This might have been caused by his parents being misinformed on the symptoms, effects, and treatments of the disease. When mismanaging the condition, many patients can undergo surgeries that are not necessary. In the images that are provided, we can see ossification that is displayed in the right and left arm.